Hey everyone, welcome back to the channel. I'm John Miller, and today we're diving into a topic that many people feel confused or even scared to talk about: HSV, also known as the Herpes Simplex Virus. Don't worry, I'm going to break everything down in the simplest way possible. Symptoms, types, treatments, real facts, and even the myths people still believe. Point. So, if you've been searching for clear, honest, and helpful information, you're in the right place. Let's start from the basics. What exactly is HSV? HSV stands for Herpes Simplex Virus, a very common viral infection that affects millions of people around the world. And here's the part most people don't realize. A lot of people have HSV and don't even know it. What is HSV? HSV is a contagious virus that usually affects the skin, mouth, or genitals. Once the virus enters the body, it stays there permanently. It does not mean you'll always have symptoms, but the virus can become active from time to time. There are two main types of HSV, and each works a little differently. HSV-1, oral herpes. This is the one that typically causes cold sores or fever blisters around your lips or mouth. HSV-1 can also spread to the eyes and, in rare cases, to other parts of the body. HSV-2, genital herpes. HSV-2 usually affects the genital area. It causes painful blisters, sores, itching, and irritation. Many people with HSV-2 might experience outbreaks a few times a year, while others barely get any. Important. Both HSV-1 and HSV-2 can be passed through skin-to-skin contact, even when there are no visible symptoms. How do you get HSV? Most people believe HSV only spreads through sexual contact, but that's not fully true. Here's how it spreads. Kissing, sharing drinks, toothbrush, lip balm, HSV-1, oral sex, vaginal or anal sex, skin-to-skin contact with an infected area. Touching a sore, then touching another part of your body. And yes, you can get HSV even if the other person has no visible symptoms. That's called viral shedding. Symptoms of HSV. Let's talk about the warning signs. Keep in mind, some people get intense symptoms and others get none. Common HSV-1. Symptoms: cold sores, tingling or burning around lips. Fever or swollen glands during first outbreak, dry, cracked lips. Common HSV-2 symptoms: painful genital blisters, itching and burning. Pain while urinating. Flu-like symptoms, lower back or leg pain. Sometimes symptoms come before the actual sores, like a tingling or little electric shock feeling. Recurring outbreaks. HSV outbreaks are different for everyone. Some get them often, some rarely. What triggers outbreaks? Stress, weak immune system, illness. Fatigue, menstruation in women. Skin irritation, not enough sleep. You can reduce outbreaks by managing stress, improving sleep, and keeping your body strong and healthy. Can HSV be cured? Let's clear the biggest confusion. No, there is currently no permanent cure for HSV, but HSV can be managed very effectively. Doctors usually recommend antiviral medications: acyclovir, valacyclovir, Valtrex, famciclovir. These medicines reduce symptoms, speed healing, and lower chances of passing the virus to others. Natural ways to reduce outbreaks. You can also lower flare-ups through lifestyle habits. Boost your immune system. Sleep well, reduce stress, eat foods rich in vitamins C and E, avoid triggers, stay hydrated. Some people find relief using aloe vera gel, lysine supplements, or cold compress, but always ask your doctor first. How to diagnose HSV? If you feel unsure, the best thing you can do is get tested. Doctors may use swab test from a sore blood test, PCR test. You don't need to feel embarrassed. Millions of people get tested for HSV every year. Important, real facts about HSV. Let's clear up some myths once and for all. Myth: only dirty people get HSV. No, anyone can get it, even from simple skin contact. Myth: you'll always have symptoms. Many people live with HSV without any visible outbreaks. Myth: it ruins relationships. Absolutely false. Many couples manage HSV safely with communication and care. Myth: you can't live a normal life. You can. People with HSV get married, have families, and live completely normal lives. How to protect yourself and others. Here's what helps reduce the spread. Avoid kissing or sex during outbreaks. Use protection. Take antiviral medicine if prescribed. Don't share personal items. Wash hands after touching affected areas. With the right care, HSV becomes manageable. When should you see a doctor? Reach out to a doctor if you notice. Frequent outbreaks. Pain that becomes severe. Symptoms spreading to eyes. You're pregnant and have HSV. You're unsure about symptoms. Getting proper medical advice early makes everything easier. HSV is more common than people think, and there's nothing to feel ashamed of. The more you understand it, the easier it becomes to manage it. If this video helped you, hit the like button, share it with someone who needs clarity, and subscribe for more real, useful health guides. Thanks for watching. I'm John Miller, and I'll see you in the next one.